Nate Checketts. I'm the Executive Director of the Utah Department of Health. I've been with the Health Department for 16 years now. I started back with the Children's Health Insurance Program. Most people didn't know very much about the Department of Health 2 years ago. I mean, they probably knew that the state had a Department of Health, but they probably had no idea we had a state epidemiologist. Obviously, with COVID for the last 2 years, everybody knows COVID-19 and everybody knows the Department of Health for the role we've had there. They've seen those daily press briefings. They've worked with their local health department, received services there, and probably everybody has really had an intimate experience with a nose swab. But there's a lot of things that the Department of Health does that people aren't aware of. One of them is our Office of Medical Examiner. So while as a state and as a department, we do promote to have the healthiest people, we also have an office that examines people in death. Forensic examiners, we have investigators. We also have the medical cannabis program. So that's where individuals can receive their medical cannabis. So we actually license the qualified medical providers. We help the families get the cards that they need as their patient cards. And also we license 14 pharmacies that distribute the medical cannabis problems. So the Department of Health is scheduled through legislation to combine with Human Services next year. So in July of 2022, we'll actually be one department, the Department of Health and Human Services. It's going to be a very large organization, and it's going to take a lot to make that change. One of the things that we've focused on as we've talked about how this department should operate in the future in this combined department is to really focus in on the services we're providing and how can we make sure that as we bring together these two different departments that our processes and our services are designed to best serve the people that we're working with. So can we reduce forms? Can we make it so that our licensing requirements are similar across two different groups? Can we improve how our monitoring works so people, like if someone's getting grants from our organizations, that they don't have to go through two different processes? All of those things just to try to make sure that as the citizens and residents of Utah come in and seek services, that we can provide that in the best way possible.